of the body that is being affected. And now if that pain is not properly attended to, it can spread. And as we've seen over there, there was stasis. So with that stasis, and
that means it stays in one place.
Exactly.
That stasis.
You can also have a supervening infection, if and then these crises usually are precipitated by things. First is infection, dehydration. So if you don't treat the precipitants and you just attend to the pain, sometimes you might miss it. You might relieve the pain and the pain comes back because the factor that caused the pain initially is still there. So you must attend to that first of all.
So basically, it's pain that you see with the crisis, nothing else.
No, you see fever. If it's caused by an infection, you would see fever, you would see pain. Depending on the organ or part of the body affected, the person will display symptoms as regards that system. For instance, if it affects the chest region, something we call an acute chest syndrome, the person might come down with a cough, might come down with severe chest pain, might have breathlessness. So depending on the organ and the part of the body affected, those are the symptoms the person would manifest.
Okay, when you mentioned stasis, you also mentioned infection. So does it mean that when the blood is pooled in a place for a while, that causes infection?
Infections can cause, yes, if you have stasis of fluid anywhere in the body, you can have infection there, yes.
Is that why, they talk about infections so much, in connection with the sickle cell disorder?
Infections usually cause the crisis. And by infections, you were talking about malaria most times.
Okay.
Yes, malaria infection most times causes crisis. And then you can have respiratory tract infections in children and the likes.
Now, at what age does sickle cell disorder begin to manifest? Let me put it that way, begin to show in a child.
Usually you don't see it in the first few months of life in some children, and in some people even longer. Some people present very odd cases. You can see some people presenting at 18 before you even know that they are sickle cell
almost
patients.
Adulthood.
Yes, some
but
people
for
at
the
5.
child, how does a parent know this could be the sickle cell disorder as early as maybe a year old?
Which is the reason why we say any couple who want to get married or have children together should know their genotype. If they are at risk of having a sickle cell child, that's if both partners have the S gene, so they are at risk of having a sickle cell child. They can then have a prenatal diagnosis done. A prenatal diagnosis is an investigation.
Okay, we are seeing the method of inheritance now. So each parent needs to have just one S gene for the child to get the disorder, right?
Yes. So if both partners are AS, there's a 25% chance in every pregnancy that the child would have sickle cell disease. There's this myth in Nigeria that says it's the fourth child that will have it.
Yes, people believe that it's the fourth child who will come out with the SS
in
gene.
Each pregnancy, there's a 25% chance.
Each pregnancy, yes, so it's like shaking the dice.
Yes, so I've seen a couple.
Anything could happen.
Both of them AS. They have 7 children. None of them has the sickle cell disorder. And I've seen a couple, both of them AS. 4 children have the sickle cell disorder.
4 children?
Yes. So it just depends on what dice is thrown.
Oh, wow. And then, isn't it expensive to take care of?
As every other chronic disease, it bears its own cost, its own economic implications on the family.
So nothing extremely special?
No, I won't say that. It is expensive, and sometimes it affects a lot of families because they might not be able to provide the money for the care for the children, which is where we come in at the Sickle Cell Foundation. We help people who are suffering from the sickle cell disease live as much as possible a pain-free life by providing basic services that they need at a very reduced cost or no cost at all.
Okay, let's come back to the young child. You've advised that anybody who is at risk, maybe somebody with the AS gene or the SS gene, that person is at risk of giving it to the child, or so to speak.
Yes.
Now, those people should be watching, right?
Yes.
Do they come immediately the child is born, before the child is born, or what should be done?
It's advisable that they come when the woman is pregnant. By pregnant, I mean between 8 to 13 weeks.
At that time, you can find out?
At that time, we can do an investigation called a prenatal diagnosis via chorionic villi sampling, and we can take some cells from the mother and find out the genotype of the child she's carrying inside her. So if it is discovered early that the child she's carrying is HBSS, then adequate measures can be taken to prepare adequately for that child. So when that child is born, you don't wait till the child starts having crisis before you start taking the necessary precautions to avoid the crisis.
So time is of the essence.
Time is of the essence, yes.
Okay, now let's move on to the teenager. Somebody develops it in teenage. How does that happen? Why didn't the person start to manifest it earlier on?
Some people are born with really high amounts, or they retain high amounts of the fetal hemoglobin that we mentioned. That sometimes can mask the symptoms till later stages in life. So sometimes you see a 15-year-old who still has a very significant amount of hemoglobin F, and you'll find out that the person through this while has not been having crisis, but the person comes from a good home where eats very well, takes a lot of fluids. If anything comes up, the parents attend to it immediately. In those sets of people, you usually don't see them coming down early in life.
Does this disorder affect physical development?
Sometimes it does, yes.
But it can be prevented?
Yes, it can be prevented.
Every time it's because the person reported early?
Yes. If you report early, you start your routine drugs, which you are meant to take early. You register in a dedicated sickle cell clinic where they see the child not only when the child is ill, but there's a routine visit maybe once a month, once every 2 months or 3 months. And the child goes, even when the child is not ill, the doctor takes a look, does some physical examination and investigation, and says, okay, this child is fine. The child continues his or her routine drugs. The child will be fine.
Okay, you've mentioned acute chest syndrome. You've mentioned the hand and foot syndrome, pain. Are there other things that could occur?
Complications of the disease, you mean?
Yes.
Oh, yes, there are a whole lot. For instance, children with sickle cell disease between the ages of 2 and 16 are at high risk of coming down with a stroke that we see in elderly people who have hypertension, diabetes, and the sorts. But in sickle cell disease, it's more common in children between the ages of 2 and 16.
A stroke?
A stroke, yes.
What does a parent do with a stroke at 2? Can this be prevented?
Yes, it can be. It can be. Like I tell my patients, the difference between your child having a stroke and not having a stroke is like night and day. So it can be prevented. There's a test you can do called a transcranial Doppler. And what that test does is it looks at the child's blood flow, through looks at the vessels supplying the supplying blood to the brain in the child. That's the transcranial Doppler. So by that you can now say, okay, this child is at risk of having a stroke. This one is at intermediate risk. This one moderate. This one standard. Okay,
there's a question for you, but I can't give that now.
Okay.
We'll do that after the break.
Okay.
Let's take a quick break. We'll come back shortly after that, and you can phone in with your questions. You're welcome back. We're discussing the sickle cell disorder with Dr. Ajibola Sanda. And sickle cell disorder, very, very common. We have in this country more than half of the burden, 150,000 children born every year with the sickle cell disorder. And okay, it's time now for you to call in. So excited about this discussion, I almost forgot. The number to call is 0808 054 2233. It should be on your screen. That's 0808 054 2233. You were mentioning the transcranial Doppler test, which shows the blood flow. Now, that blood flow now shows you